name is Angela Hong. I'm a radiation oncologist with expertise in the management of patients with bone and soft tissue sarcoma. I work in Sydney, Australia. I'm a director and also the co-chair of the Scientific Advisory Committee for the Australian New Zealand Sarcoma Association. So ANZSA is a not-for-profit organisation based in Australia and New Zealand with a goal of improving the treatment outcome for patients affected by sarcoma. I went to medical school at the University of Sydney, and then I went overseas for experience fellowship training for about 18 months in the US before returning to Sydney to start my formal training in radiation oncology. After that, I complete my PhD, and that's in the area of skin cancer, sarcoma, looking at radiosensitivity, so how different cancer can affect or respond to radiotherapy in a different ways. My career turning point is really be able to step into the sarcoma world as part of the multidisciplinary team. It's a very close-knit committee. We have multidisciplinary input with surgeons, pathologists, medical oncologists, radiologists, all work very closely together to try to work out how best to diagnose and manage patients with sarcoma, how we can do to improve the outcome. Sarcoma is rare cancer. It's not easy to make a correct diagnosis, so I rely heavily on my radiology college and pathology college to make the diagnosis. And the management is not one size fits all. We really have to tailor the treatment to the individual patient, to the stage of disease, in combination of surgery, chemotherapy, immunotherapy with radiotherapy. And that's very challenging. And that's what I find interesting. It's not one size fits all at all. I do mainly clinical research, and recently ANZSA has been able to sponsor an international trial looking at patients with high-risk soft tissue sarcoma of the extremity, looking at adding in immunotherapy in addition to standard treatment of surgery radiotherapy. This trial was a randomized trial for patients with more than 5 centimeters in size, grade 2 or grade 3, liposarcoma or undifferentiated pleomorphic sarcoma, randomized to have radiotherapy plus surgery or immunotherapy in addition to surgery and radiotherapy. The trial was presented 2 weeks ago at ASCO, and that showed a significant benefit in patients who had immunotherapy. So what we saw was an improvement in the 2 years disease-free survival, meaning that patients who had immunotherapy were less likely to have the sarcoma come back or die from the sarcoma at 2 years. The benefit was from about 52% in the standard group to 73% in the experimental group. So we're very pleased with that result. This trial was part of an international study in collaboration with SARC, which is a US-based organization, not-for-profit, for sarcoma research. I think it's an honor for us to be part of the journey for patients with diagnosed or affected by cancer, making a difference. The outcome might not be good for every patient, but if we can make the journey a bit better, make them feel better, help to fulfill the wish, I think that's a very good outcome. To try to relax and get away from things, I do a lot of knitting. So that's 2 hands. You can't scroll the phone at the same time, and so really therapeutic. I like to exercise a bit. My family loves to ski, so it's one of those things that we like to do once or twice a year, a ski trip with the family, and it's excellent time. You get up, get ready, plan your day, pack your lunch, come back tired, but you sit together, have a dinner together. So we really enjoy that.